Hey guys, I get asked a lot when we do our role plays about confidentiality and how to handle, for example, if a third party comes in and asks you about a different patient's records. I want to talk about three key things that I see a lot when it comes to our role play scenarios. Number one, no disclaimer. Number two, flip the situation. And number three, leave a gap in the door. So what I mean by these things, number one, no disclaimer. The amount of times that I see when someone comes in to talk about their father or their daughter or their son, for example, the person hasn't even sat down in the chair and we need to get our disclaimer out. Oh, by the way, just so you know, I can't give you information about your father or son or daughter, but you can give me all the information that you want to give me. Now, that of course is true, but what does it do? It puts a massive barrier in the way. The person's probably coming really worried to talk about their relative, and we've come in and put this big door in the way and blocked things off. It just doesn't set the right tone. Just let them come in, how are you? How can we help? What's the problem? Let them start to open up. And then if they say, oh, doctor, what did my, mum say when she came last week? That's when you put in the line about confidentiality. So number one, please don't put in a disclaimer. It doesn't help when it comes to interpersonal and communication skills. Number two, flip the situation. What do I mean about this? Now, yes, if someone says, doctor, what did my mum say last week about her headache? Of course, you can go in there and put in the actual confidentiality line that, unfortunately we can't give information X, Y, Z. But actually, sometimes flipping the situation makes it much easier for the other person to understand and sometimes doesn't come across as so harsh. So Mrs. X, I know you're really worried about your son, but just imagine if your son came in and asked us about information on your medical records. In the same way that I'd really struggle to tell him about your records, unfortunately, I can't give information about his records without him knowing. Now, straight away, that person understands the principle of confidentiality. They just get it because you've made it personal to them, and it's probably going to go down a little bit easier and come up maybe with a little bit less arguments back or reasons why they still think that you should tell them. So number two, flip the situation. It really does work. And number three, leave a gap in the door. One thing that we see too often is people put a almost iron cast rail in there, just so you know everything is going to be kept confidential. Now we're talking about when someone comes in and maybe they're a bit quiet, just so you know everything's going to be confidential. Look, that's not the case. They're going to maybe tell you something that actually is not confidential. So you need to leave a little gap in the door so that if you need to walk out, you can walk out. Just so you know, Mrs. X, everything that you say today is going to be confidential, unless of course we're worried about anyone. Now that straight away leaves a little gap in the door so that if you need to break confidentiality, you can, but also it gives them enough encouragement that whatever you tell us is generally going to be between you and me. So three different points about confidentiality. The first two about when someone comes and asks for information about somebody else. The third is when someone's a little bit quiet and they come in and you want to use that confidentiality line. Number one, no disclaimer. Number two, flip the situation. Number three, leave a gap in the door. We work on these kind of things much more in our Stage 3 CSA PLAB 2 communication skills courses. You know what the hashtag is, can pass, will pass, hashtag I went with Arora.